a practicing physical therapist and co-owner of a small physical therapist practice in the greater Cincinnati, Ohio area. We currently employ 24 individuals in 3 clinics and serve approximately 180 patients per week with musculoskeletal impairments. Our goal is to return these individuals to the highest level of function and productivity in their homes and their communities. Thriving in this payment environment is a challenge for small businesses in physical therapy. The physical therapist small business climate in Cincinnati has seen this firsthand. In the past 3 years, 14 clinics have closed their office doors due to the negative pressure on payment. My partner and I have personally reduced our salaries, eliminated our advertising budget, and seen significant increases in administrative and operating costs. Today, I represent the American Physical Therapy Association and their private practice section, which advances small business ownership of physical therapists. If Congress does not act July 1, 2008, payments under the Medicare physician fee schedule will be cut by 10.6%. This would begin a series of payment reductions under the fee schedule, leading to an overall reduction in payment to healthcare providers of 40% in 2016. APTA supports efforts to avoid the 10.6% cut in payments under the Medicare physician fee schedule and to replace the flawed sustainable growth rate formula with a more accurate indicator of healthcare inflation. Payment cuts on care physicians will have significant ramifications on the ability of physical therapists to serve individuals who have suffered from stroke, had joint replacements, diseases that impair their ability to move, walk, and their daily tasks. Physical therapy continues to be a critical need for Medicare beneficiaries. A recent Center for Medicare and Medicaid Services study indicated that 8.5% of Medicare beneficiaries utilize outpatient physical therapy services, resulting in 3.9 million patients in 2006. The demand for high-quality rehabilitation services by physical therapists will only increase as baby boomers age and people seek the services of physical therapists to keep active and productive. The impact of the pending cuts on physical therapists' small businesses can be summarized by 3 points. First, beginning July 1st, in addition to a 10.6% reduction in payment, physical therapists will also be subject to a $1,810 per beneficiary per year therapy cap on outpatient services. This would limit patient access to needed physical therapy by not considering the patient's condition, their diagnosis, or other contributing factors. This represents, in essence, a cut upon a cut and would make the viability of physical therapists' small business a significant challenge. APTA recommends the passage of the Medicare Access to Rehabilitation Services Act, H.R. 748, legislation to repeal of the therapy caps. Second, physical therapists in private practice have significant limitations on how patients may access their services and marketplace. Currently, Medicare requires that the patient be under the care of a physician as a prerequisite for payment of therapy services. If the payment cuts go into effect and physicians stop taking Medicare patients, then access to physical therapy services will be impacted as a ripple effect. APT advocates for the passage of the Medicare Access to Therapist Act, H.R. 1552, as a strategy to improve access to physical therapists. As physician practices struggle with the payment cut, the incentive to develop additional sources of revenue increases. This puts physical therapists' small businesses at a competitive disadvantage since patients cannot directly choose their physical therapy provider and are often directed to clinics in which referral sources have financial interest. APTA advocates stronger self-referral provisions and federal ensure the integrity of the healthcare delivery service. Third, physical therapists and small businesses are subject to burdensome administrative and regulations that add to providing health care. Administrative physical therapists direct the away from patient care and make it difficult to sustain physical therapists' small business over the long term. The compounding effect of payment cuts under the Medicare physician fee schedule, along with limitations on patient access, a competitive marketplace, and regulatory burdens, makes it difficult to sustain physical therapy small businesses. Congress must move beyond the issue of temporary payment and look at the physician fee schedule for the long term.